Hi, this is Dr. Bell, and on this video series, we're going to talk today about solutions to back pain and disc-related arthritis conditions. So some of the more common symptoms of arthritis is going to be pain, swelling, stiffness. Usually the pain comes and goes when it's earlier on in the condition, and usually you're not feeling it too often. It's not a major concern. So usually it starts off mild, but by the time a patient sees us here in the office, it's going to be a pretty frequent occurrence. It's going to happen with even simple, strenuous activities or lifting activities. It's going to typically be hard to sleep, or there's going to be pain with sitting. But whatever the symptoms are, generally they're not going to go away on their own, no matter what type of services or treatments or therapies that you've tried. So the vertebral disc is a soft cartilage type material that separate the bones of the spine. And it acts as a cushion for the discs, but it also allows space for the nerves to exit the spine. The interesting thing about the vertebral disc is there's not a great blood supply to it, and it typically dies off around the age of 12 to 14 years. So for most of your life, there's no direct circulation going through the disc, and that's why it can be damaged so easily. There is blood supply outside of the disc, but when there's damage to the disc, it can cause the fluid to essentially leak out or dry out, and so there'll be various conditions that you can suffer from. But essentially, once the damage is there, it can be very hard to undo that easily. So, of course, you want to maintain cartilage and keep it as healthy as you can throughout your entire life. And like I said earlier, the cartilage prevents the bones from rubbing together, but it also allows your spine to move and flex and bend so you can ambulate throughout life. And so you can see here in the diagram on the right, the very top disc is what a normal disc would look like. As the disc starts to break down, it starts to do what's called degenerate. It can start to thin slightly, but when it gets more pressure on it, it'll start to bulge, and then when the pressure gets extreme, then it starts to herniate. And when the water is almost completely dried out, you might have heard of a term called bone on bone, and this is where the discs will be very thin, and you can actually see this happening on an X-ray. So as you can imagine, the discs are sensitive to pressure, and gravity isn't necessarily a friend to our spines. And what this diagram is showing you here is that the most neutral position where there's the least amount of pressure on the disc is when you're lying flat or on your side. Normal pressure is considered standing, and then you can see as you bend forward with weights, it can double the pressure on the disc. And you can see sitting increases the pressure on the disc, which we do a lot of in our modern society. And then if you're sitting with some sort of weight, like this example looks like the little character is exercising, you can see that increases the discs almost 2.5 times. So again, it's very important that spinal posture is maintained, as well as reducing the pressure on the discs from lifting too much weight. So one of the best ways to look at the disc itself is through an MRI study. You can see some thinning of discs or degenerated discs on X-ray, but the best way to view it is with an MRI. And so a bulge or a herniation is what you can see here, where the red arrow is at. And to the right of that, you see sort of a dark line or a gray line going vertically or up and down, and that's where the disc is putting pressure on the spine. And this is a very potentially dangerous situation in some cases, but certainly pressure on nerves is not a good thing. We can see muscle weakness, you can see pain, you can see spasms. You'll also potentially get numbness, tingling, or burning in your legs or your arms and hands and feet. When I started in practice 20 years ago, it was very rare to see younger people, and by younger I mean people in their 40s and under, with arthritis. But that's become a lot more common in the last I'd say probably 5 or 10 years, just because we sit so much, we live on our phones, we don't do a lot of physical activity, or as much physical activity as we should. And so you can get arthritis at any age, and statistically about half of all patients that have arthritis are under age 65. And a lot of this comes from your lifestyle choices. And so we can see some of the major causes being physical trauma, injuries that you had, and this could even date back to when you were a child and maybe you had a sports injury. Certain drugs and combinations of drugs can actually speed up arthritis or cause the development of arthritis. Diet is certainly a huge one. The standard American diet is largely inflammatory, and inflammatory foods can cause degeneration of all joints in the body, which is also related to inflammation from toxicity and also autoimmune issues as well. There are a couple ways you can self-diagnose yourself, if you will, and there's a difference between nerve pain and muscle pain. And the way that we separate the two is you'll see typically in a nerve burning, stabbing, electric shock like pains. And if it's a muscle issue, it's typically going to be tender to the touch. There'll be achiness either around the joint or in the muscle. And also there will be stiffness in the joint. And often that stiffness will improve with motion or like stretching, those types of things. So in this slide, we're looking at the traditional or Western approach to back pain and arthritis. And typically that'll start with a visit to your MD or your primary doctor, if you will. And the usual initial course of care is going to be some sort of medication, most likely a pain reliever or an NSAID like Advil or Aleve, Motrin, something prescriptive like that. And after a few months or years of trying that, maybe the next step would be an X-ray or an MRI, which is usually a screening tool to see if there's anything going on. And then of course, that's when we'll find that there's some arthritis or some sort of problem happening. And depending on how long that process has been allowed to go on, that'll determine the severity or how bad the arthritis is. Generally, that will lead to the next step of visiting or getting a referral to a neurologist or an orthopedist. And at that point, there'll be some sort of steroidal injection administered. And since we're talking about back pain here in this presentation, that could be an epidural injection directly into the spine. There's other forms of injections you can do. And once that wears off, then typically there sometimes might be physical therapy, but generally it's going to be then a discussion of surgical intervention. So the one question that I've pondered a lot, and maybe it's something you've pondered as well, but if we're only treating symptoms, or if I'm only getting treatment for my symptoms, is that the right thing for me, or are we doing the right thing by taking this type of approach? So is traditional medicine on the right track for back pain and arthritis and chronic conditions? I would argue that is not the case, simply because by the time we're treating symptoms, it's usually already too late. But we have to address the underlying cause of the problem. And by addressing the cause, then the symptoms go away on their own. And by doing that, we can eliminate a lot of treatments that have harmful side effects or have just simply no results at all. So once pain medications have stopped working or the problem has become worse, in a traditional Western medical approach, a cortisone injection will be the next step along the path. And so these are sometimes called epidural injections or steroid injections or cortisone injections. Those will be the three terms that you'll commonly hear. They're a very powerful class of drugs that produce an anti-inflammatory response. It can reduce swelling. But the big problem that we see with cortisone injections is in limiting the body from causing further damage. Because it is intended to stop inflammation, it's intended to stop pain, that is also going to be a potential area for injury, re-injury, or further injury, because your brain won't pick up the signal that the activity you're doing is causing pain. And so by eliminating the pain response, you don't know when to stop. And so that's why you can actually injure yourself or cause a worsening of the condition with cortisone injections. So hopefully the reason you're sitting in our office today watching this presentation in the waiting room is because you're hoping to avoid spinal surgery or any kind of surgery really. But today we're talking about back pain and arthritis. And if surgery is something that you have to undergo, the statistics aren't very great in terms of the longevity or the long-term ability for it to provide you relief. Approximately 20 to 40% of all spinal surgeries will fail. 29.2% statistically will have no change after 6 months. And about half of patients with failed surgery, they were misdiagnosed, which meant that they had the wrong surgery. So a lot of times, because of the immobilization of the spine or the fixation of the spine, which is what you can see here in these two X-ray pictures, that does cause weakening of the bone, but it also can cause excess pressure on the discs right above the surgery. And so very commonly, within about a decade or so, there's usually a need for a second surgery to fix the effects from the first surgery. So our goal is to help patients avoid surgery, and if it's not necessary, then of course that's what we'd love to help you with. There are always going to be cases where surgery is necessary, but if you do in fact qualify for one of our programs here in the office, our therapies are safe, effective, and natural. Some of those services we offer are disc decompression, chiropractic care, trigger point injections, regenerative medicine, functional medicine, and then also therapy and rehab/exercise. We were one of the early adopters of disc decompression. We've had these machines in our office since 2005. And the purpose of these machines is to decrease the pressure on the disc, increase the fluid flow to the disc so the disc can rehydrate, but also relieve the pressure on the nerves. And by doing all of this, what decompression will help do is restore motion to the spine. And of course, you can imagine that would also reduce pain, discomfort, swelling, etc. Our practice started in 2001 with chiropractic care, so we do believe strongly in chiropractic care. We're now an integrative practice, so we offer not only medical services, but also chiropractic services, massage therapy, things like that as well. But with chiropractic care, pressure on the nerves can influence the ability of your brain to transmit and receive information. This is what chiropractors are taught in school. And so when we have spinal problems, we can have issues where the health of the body through the immune system, which is ran by the nerves, that can also be affected. So chiropractic philosophy isn't really just about pain, which it's of course very effective at reducing muscle spasms, pain, and inflammation. But the bigger picture of chiropractic care is that by keeping your spine in alignment and getting a regular adjustment, that allows your body, which is capable of healing itself, it allows the body to be able to do that more easily because there's less pressure on the nerves. The immune system can work a lot better. So when there's long-standing issues with muscle spasms or spinal misalignment or even degenerated or herniated discs, a lot of times this will cause tension in the muscles. It'll cause abnormal pulling and pressure in areas that really aren't supposed to be there. And when this happens in the muscle, this is called a trigger point. And so you can feel these sometimes on your back. A lot of people will say there's a knot in my back. It'll feel like gristle on a steak. It can be kind of a hard nodule. You can actually feel these. And so it's really important that the trigger points are kept to a minimum because they are at the endings of the nerves. There's typically a nerve attached to it, so they can be painful. It can cause a lot of pain with motion and moving. And it also gets mistaken a lot of times for fibromyalgia. And so that's definitely a diagnosis that you don't want to have. So trigger point therapy is something that we offer not only through our medical department, but also through our massage therapy program as well. Trigger point therapy is something that works great with our decompression and our chiropractic program because trigger points, once they're there, those knots are very hard to get rid of. And so Trigger point therapy is an injection of a local anesthetic. Typically, we're using lidocaine, which is non-steroidal. It's a very simple injection. It's only injected just a half inch or so below the surface of the skin, so it's something that's minimally invasive, but it does help the muscles relax. It does give you some relief after the procedure for a few hours. But what we find is it does help your body hold the chiropractic adjustment longer. And it also allows decompression to do a better job, because when muscles contract, it can actually put compression or compressive pressure on the spine. And of course, one of the nice benefits is that it's a very quick way to get you relief when we're trying to do therapy that can take several weeks to accomplish its goals. You might have heard of regenerative medicine. This is a newer branch of medicine that's sprung up in about the last 10 years. We added regenerative medicine in 2014 to our practice when we added our medical team. And so regenerative medicine focuses on science and research and what stem cells do inside of our body. And so anytime we have a regenerative medicine procedure as part of a care plan, the goal is to help stimulate the body's inborn repair response, and this happens through stem cells. Stem cells signal your body to heal, but what will happen is the wear and tear will be reduced, and we will also be looking at helping to restore the cushion and stability to the joint. Regenerative medicine is a great option if you're looking to avoid surgery. So we've been at this for about 20 years, and having started with traditional chiropractic care, in 2001, I feel we're very, very good at what we do, and our services, because they're safe, because they're non-invasive, and we've had a long time to get it right. I know that from a patient's perspective, that what I would want you to know is that we know what you're going through. With the services that we've added and things that we've tried throughout the years, we have a plan that can solve your problem and help end your suffering. We're not traditional medicine. Most of our patients come to us because they were failed by traditional medicine, and that's where our niche is at, and that's what I feel we do a very good job at. We look at our job as to get you better and to help you get your life back, because the one thing that we cannot get back in life is time. It's the most precious commodity we have. And so if we can do anything to shorten that time period for you and to end your suffering that much quicker, that's huge, I think, for someone's quality of life. But also, if we cannot help you, we're going to tell you that as well, because again, we don't want to be another failure for you, and we will be honest with you. If we can't help you, we'll tell you who your best option would be, so you can find the relief that you need. So we are a non-traditional office for most intents and purposes. We do blend some Western medical techniques with chiropractic techniques, along with some Eastern medical philosophy as well. So there's a lot of tools that we have where we don't have to prescribe drugs or cortisone to patients. So we'll use typically a combination of disc rehabilitation with decompression, chiropractic care, trigger point injections, regenerative medicine, laser therapy, functional medicine, and massage therapy. So your consultation process will determine what combination or care plan that we need to develop for you, and those are all customized per patient for individual patients. So once we determine what your needs are, that'll determine what our course of care is going to be with you. So I wanted to take a quick moment and introduce you to our treatment team here at Vitality Integrative Wellness. So we'll go left to right. We have Dr. Matt on the left. He is our chiropractor and does our new patient consultations out of our Hemet office. We have Dr. Jen, who is our chiropractor, and she also does new patient consultations out of our Temecula office. Next, we have Allison. She's our nurse practitioner, and you'll meet with her and consult with her out of both offices. She goes back and forth. And then On the right, this is me, Dr. Bell, and I guess you could call me the founder and CEO. I'm not too big on that title, but this is a creation that I had in 2001, and we've just been expanding and doing great things for patients ever since. And I love what we do, and we have a fantastic team here at Vitality Integrative Wellness. So if you're suffering from back pain and you would like to speak with us about the natural solutions that we offer for back and neck pain, please give us a call at 951-225-4419, and we can get you booked for a consultation at the earliest appointment that we have available. We also would welcome spouse, friends, or family members that you may know that are also suffering from back pain. Feel free to have them watch this presentation or have them give us a call, and they can certainly come in as well if you'd like to get them some help. If you'd like more information, you can check us out at our website, www.growwithvitality.com. You can also check us out on social media on Facebook and Instagram at Vitality Integrative Wellness. So that's it for our presentation today on back pain, and we look forward to seeing you in the office very soon. Thank you for watching.